Hello everyone, welcome back to my channel Dr. Garima Mis.Medicine. So, let's discuss Haryana MO exam 2022. The first question is, which among of the following is the most common site where appendix is found during appendectomy is retrocecal? Retrocecal is 64%, post-ileal is 0.5%, and pre-ileal is 1%, subcecal 2%, and pelvic is 32%. Means most common is retrocecal and the least common is post-ileal. Next question, an injury to which the following nerve leads to winging of scapula is long thoracic nerve. Which of the following structures serves as the anatomical landmark for the pudendal nerve block is ischial spine? Next question, which one of the following nerves divides the parotid gland surgically into superficial and deep parts is seventh cranial nerve, which is facial nerve? Next question, carbon dioxide retention is rarely a problem in a patient with alveolar fibrosis because diffusion capacity of the lungs for the carbon dioxide is much more greater than the diffusion capacity for the oxygen. Next question, in a patient of hemorrhagic shock, there occurs vasodilation of the coronary circulation. Next question is rapid action of the drug albuterol, which is used in the bronchial asthma, is mediated through beta adrenergic receptors. Next question, narcolepsy is triggered by the abnormality of the hypothalamus. Next question, ninth one is the mitochondrial DNA is inherited from the mother. 10th question is, when the blood sample is collected in a heparinized tube and centrifuged, it will get separated into plasma, buffy coat, and RBCs. Next question, all of the following hormones are hyperglycemic except insulin, but because it causes hypoglycemia. Hyperglycemia causes cortisol, thyroxine, and growth hormone. Next question is, a 70-year-old, as a result of severe vomiting, the doctor on duty administered to the patient a parenteral medication to treat vomiting, following which the patient developed grimacing and abnormal posture. Which out of the following could have been the inciting drug for this reaction is metoclopramide. अगर एंटी वॉमिटिंग मीन्स एंटी एमिटिंग ड्रग जो हम कोई भी दे ना, मतलब कोई भी साइड इफेक्ट दे रहे हैं, मतलब साइड इफेक्ट हो रहा है, अगर हम कोई भी एंटी एमिटिक ड्रग दे रहे हैं तो उसका मोस्ट कॉमन आंसर होता है मेटोक्लोप्रामाइड, क्योंकि ये सबसे ज़्यादा सिम्टम साइड इफेक्ट्स कोज करता है. नेक्स्ट क्वेश्चन, अ पेशेंट 50 years of age presented with the chief complaints of throbbing headache with the frequency of more than 3 attacks per month, with each episode lasting for around 24 hours. Which one of the following drug is most suitable for the prevention of such attacks is valproic acid? There is migraine prophylaxis, which you can remember like toy BC, 2ABC, or 2ABC, which is T means TCA, A means anti-epileptics, and B means beta blockers, C are the calcium channel blockers. Next question, which one of the following antimicrobial agents needs dose reduction in renal failure is amphotericin B? 15th question is, which among the following conditions is an acquired cause of hypercoagulable state, which is heparin induced thrombocytopenia? Next question is, which out of the following is the best test for the assessment of iron status is serum ferritin level? Next question, which one of the following poisons retards putrefaction is arsenic? 18th question is, fixation of postmortem hypostasis occurs in 6 to 12 hours after death. Next question is, which of the following choices is the best specimen of bone for determination of sex of an individual for skeletal remains pelvis? Next question, which among the following does not enter the human body through skin is Trichinella spiralis? 21st question is, SSS syndrome, which is staphylococcal skin scalded syndrome, is mediated by epidermolytic toxin. Next question, which of the following conditions can occur as a result of the fifth cranial nerve palsy is neuropathic keratopathy? Next question is a 2 month old child is brought to the ophthalmology OPD. Next question is a 2 month old child is brought to the ophthalmology OPD with the complaints of sticky and watery eyes since birth. Which one of the following would be the best intervention for this condition at this age? Sac massage is the answer. Less than 6 months, sac massage will be the good treatment for the newborn baby. Next question, reactionary hemorrhage after tonsillectomy occurs during first 24 hours of tonsillectomy. 25th question, in which of the following anatomical sites is a fungal bole most common, which is maxillary sinus? Next question, all of the following antimicrobials are used in the treatment of malaria except amoxicillin plus clavulanic acid. And here is malaria treatment. If the patient have infected with the Plasmodium vivax and the Plasmodium falciparum or mixed. If it is Plasmodium vivax, the treatment will be chloroquine. Until delivery, no primaquine but weekly 300 mg chloroquine. If the patient is infected by the Plasmodium falciparum or mixed, in the first trimester, we have to give quinine 10 mg per kg TDS plus clindamycin 10 mg per kg BD for the 7 days. Or if it is second or third trimester, we can give ACT, ASP or AL. Okay, so the next question, which out of the following is the most common valvular abnormality seen in rheumatic heart disease is mitral stenosis? Next question, which one out of the following is the most common finding in an aphasic patient is anemia? Next question, all of the following drugs are used in the management of hepatic encephalopathy except diazepam. 30th question is a primary tumor of which of the following organ is least likely to metastatize to the bones is colon. All of the following clothing factors are formed by the hepatocytes except factor 8. Next question, all of the following are the risk factors for the developing chronic obstructive pulmonary disease except recurrent respiratory infections. All of the following are RNA viruses except herpes. I'm sorry, the question was invalid. Okay, though in these two options are the answer: herpes simplex virus and cytomegalovirus. And the next question is a 25-year-old G2P0A1 presented to the labor room with a history of amenorrhea of the 6 weeks, having bleeding per vagina along with the pain abdomen for the last 1 day. On examination, her pulse rate was 100 per minute, BP 110 70 milligram and abdomen not tense and slightly tender. On per vaginal examination, cervical os was closed and a tender mass of size 3 cm into 2 cm could be felt in the right fornix. Which out of the following is likely? The diagnosis in this case is unruptured ectopic pregnancy. Okay, the next question. A 16-year-old female presented to the gynecological outpatient department with chief complaints of not having attained menarche as yet and experiencing cyclical pain in the lower abdomen for the last 1 year. And everyone know that answer is cryptomenorrhea. Okay, the next question is which condition out of the following is not contraindication for venous delivery? The answer is occipital transverse position is not a contraindication. Next question, which out of the following is not an early sign of uterine scar rupture is shock? Next question is which out of the following is not a contraindication for TOLAC, which is trial of labor after cesarean is the previous history of one lower segment cesarean section. Okay, next question, which of the following is absolute contraindication for usage of intrauterine devices as per WHO is current episode of sexual transmitted disease. Next question, which of the following is absolute indication for cesarean section is carcinoma cervix, and which of the following is the most suitable contraceptive choice for use by a woman having menorrhagia and dysmenorrhea? The answer is levonorgestrel releasing intrauterine system. Okay, the next question is pre-hypertension in pediatric population is defined as blood pressure 90 to 95 percentile for age, height and the gender. Okay, next question. Exanthema subitum is caused by HHV6. Next question. Which of the following is the treatment of choice for severe group, which is laryngobronchitis, is dexamethasone IM and nebulized with the epinephrine. Okay, the next question. Which out of the following is the antileptic drug of choice for the treatment of neonatal seizure, is phenobarbital. Okay, next question. Which one of the following is incorrect statement about thumb sucking? Okay, incorrect statement means हमें गलत बतानी है. It can lead to malocclusion, yes. Is a source of great pleasure, yes. Is a sign of insecurity, yes. Must be treated vigorously in first year, no. It should be treated when patient is more than 5 years or until 5 year, like 5 year till the 5 year of age is normal, and if the patient is thumb sucking even after the 5 years or bedwetting, so you should need to treat it. Okay, the next question. Which out of the following is the earliest sign of rickets, is craniotapes. Next question. Extremely low birth weight baby is a baby weighing less than 1000 grams. All of the following vitamins are inadequate quantity in breast milk except vitamin K. Next question. Primary dentition is complete by the age of 2.5 years. Next question. A 27-year-old patient was diagnosed to be having borderline leprosy and was started on MBMDT. 6 weeks later, the patient developed pain in the nerves and redness and swelling of the skin lesions. All of the following should be included in the management of this patient except stopping the leprosy treatment. Next question. Which of the following should be the drug of choice in a woman with the second trimester pregnancy presenting with pustular psoriasis? Drug. Next question 53. A male patient presents with patchy loss of hair on scalp, eyebrows, and beard. He also gives a history of rapid graying of hair in few areas. Which of the following condition could be probable diagnosis is alopecia areata? Due to chemotherapy, there is anagen effluvium, and if anyone is in stress or giving childbirth, then this will be the telogen effluvium. Next question. All of the following are the markers of the bone resorption except is the serum osteocalcin. 55th question. All of the following are true about the coda equina syndrome except asymmetrical paralysis. In which of the following condition is the 3-point bony relationship maintained in supracondylar fracture of the humerus? Next question. Hodgkin's terrible triad of elbow does not include fracture olecranon. Next question. Boxer's fracture is fracture of the fifth metacarpal neck. Next question. Multiple cannonball lesion, if present in the chest x-ray, suggestive of which of the following condition is metastasis? 60th question. Next question, which is on chest x-ray, effacement of the right heart border is a sign of collapse of middle lobe of lung. Swirl sign is in hyperdense area within hyperdense acute hematoma. Snowstorm appearance on ultrasound is seen in hydatidiform mole. Which one of the following is the investigation of choice for the detection of the gallstones? Is ultrasonography abdomen. Swirl sign, which refers to the non-contrast CT appearance of the acute extravasation of the blood into a hematoma, like an intracerebral hemorrhage, extradural hematoma, or subdural hematoma. Next question. Among the undermentioned contrast media, which one of the following or which one of the most appropriate for detecting a suspected leak in the GIT tract is non-ionic water soluble? Next question. What would be the type of the study design if during the study period data related to association between low birth weight and maternal smoking is studied by obtained history of smoking by the woman at the time of their antenatal visits, and then subsequent correlation between birth weight and history of smoking is drawn as the cohort study. Next question: to which of the following under mentioned parameters does the goal 6 of the sustainable development goals pertain to the clean water and the sanitation? Next question: as per the national guidelines for the treatment of malaria, which of the following under mentioned drug is the drug of choice in the management of malaria due to Plasmodium falciparum in a female who is in the first trimester of pregnancy? The answer is quinine. Next question: which of the following under mentioned choices denotes the amount of calories and proteins, respectively, that should be provided to a several malnourished 5-year-old child under the ICDS scheme in India? Is 800 kilocalories, 20 to 25 gram. Okay. The next question: the definition of extensively drug resistant tuberculosis, which is XDR-TB, includes MDR-RR-TB cases with the resistance to any fluoroquinolone and at least one additional group A drug. Next question: World Breastfeed Week is celebrated in first week of August. I have already uploaded the important days. You can also watch that video, it will be helpful in that exam. Next question: which of the following statement is true about the National Deworming Day? Is children within the age group of 1 to 19 years are covered in it? Okay, the next question is: according to the Sustainable Development Goal 3, ensure healthy life and promote well-being for all of the AG's target 3.1 is to reduce maternal mortality ratio by 2030 is less than 70. Okay, the next question: 3.1 was the MMR less than 70 and NNMR is less than 12. And if it is 3.2, then under 5 mortality rate less than 25, or if it is 3.3, which will be the end epidemic TB8, malaria and TD, and plus combat hepatitis, WBDs, and other CDs, communicable diseases. Okay, so next question. Leprosy eradication means less than one case per 10,000 population. 73rd question: which one of the under mentioned statement is correct regarding Mission Indradhanush? It is an activity to boost immunization of children and unimmunized pregnant women. Next question: each year the World Health Day is celebrated on 7th April. 75th question: a 2-year-old unvaccinated child presents with the fever, cough, sneezing, along with the dusky red maculopapular rash, which had started behind the ears and had spread rapidly to the face, neck, and body. His most probable diagnosis is measles. Next question: under the ambit of the National Vector Borne Disease Control Program, which is NVBDCP, which of the following is not covered is cutaneous leishmaniasis? Next question: which of the following disease was not covered under Vision 2020 program in India? Is onchocerciasis? And childhood blindness, most common cause can be cataract, vitamin A deficiency, and retinopathy of the prematurity. Okay, so there are some components which we can see in Vision 2020 components. It includes cataract, trachoma, onchocerciasis, childhood blindness, refractive error and low vision, corneal blindness, diabetic retinopathy, and glaucoma. Next question: the Ujjwala scheme, started by Ministry of Women and Child Development, is for preventing trafficking of women and the children. Ujjala is for the light and Ujjwala is LPG. Next question: the Lakshya program launched by the Government of India refers to initiative to improve quality of care in labor rooms at public health facilities. Next question: the aim of midday meal program is to supplement half of the protein and one-third of the daily calorie requirement. Next question: which of the following figure denotes the prevalence of the heart hearing impairment? Next question, which of the following figure denotes the prevalence of hearing impairment in India as per the National Program for Prevention and Control of Deafness is 0.6.3, not 6.3%. Next question, which of the following figure denotes the quantity of vitamin A in international units that is administered for prophylaxis under the National Vitamin A Prophylaxis Program is 2 lakh international unit. Next question, a staff working in the cotton textile industry is businesses. All of the following are the criteria for the high risk pregnancy except blood pressure 118 by 78, which is normal. Okay, next question. We can include high risk pregnancy, short statured, primigravida height 140 centimeter and below, elderly primigravida age 30 years and above, and history of previous delivery by cesarean section are high risk pregnancy. Okay, next question, which of the following thyroid malignancy is common after radiation exposure is papillary carcinoma? Next question, Cullen sign is bluish discoloration around the umbilicus. For which of the following condition is the Haller's operation performed is achalasia cardia? Next question, who among the following said skin is the best dressing is Joseph Lister? Next question, which of the following is the most common developing of chronic fissure in ano is posterior? Which of the following condition is associated with septic shock? The minimum area of the land required to complete sustained life of one person is called his ecological footprint. Next question, which of the following is present in the airbag that is used for the safety of the car driver is sodium azide? Next question, which of the following scientists had a major contribution in the field of science? Developed a primitive microscope and coined the term cell is Robert Hooke. Next question is the blue baby pollution disease. Blue color means nitric oxide. Okay, the Kyoto Protocol is an international treaty that commits the state parties to reduction in its greenhouse gases emission. Next question, which of the following is not discipline that is under the domain of Ministry of Ayush is allopathy, of course. Okay, the next question, which of the following Indian scientist had the distinction of receiving not only the Nobel Prize but also the Bharat Ratna is Dr. C.V. Raman. Next question, Constitution Day of India is celebrated every year on 26th of November. The book Long Walk to Freedom is written by Nelson Mandela. Next and the last one is the who among the following is a famous Santoor player is Shiv Kumar Sharma. I hope you like this video helpful and do subscribe the channel. All the best. Bye bye. Take care.